partners puts them in grave danger. You will expose every partner and their present and future partners to HIV or another STI. Use a condom every time you have sex. You can live a productive life even if diagnosed with HIV. Remember, early detection is key to your survival. Be responsible, protect yourself and others. Help stop the spread of HIV and other STIs.
There are signs everywhere. Pay attention whether you're male or female. Visit your health center to get screened. It's a preliminary test to determine if you are exposed to the HIV virus, an STI, or tuberculosis. Some people who are HIV positive also have tuberculosis. But there's hope. Tuberculosis can be cured. And yes, you can live a full life with HIV. Talk to your doctor. Be responsible. Help stop the spread of TB, HIV. Encourage everyone to get tested.
To avoid getting the coronavirus, remember to wash your hands thoroughly and frequently before and after preparing food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons who appear ill. Encourage others to wash their hands and also use an alcohol-based hand sanitizer of 60 to 70% solution. Stay away from events having large gatherings of people. You can expose yourself to more possible infections in large groups. Also, avoid sharing cutlery, cups, glassware, etc. with others. Viruses can linger on these items and may be transferred this way. Avoid shaking and holding hands, and hugging or keeping an infected person in close proximity. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
Thanks to the nation's unified response, the spread of COVID-19 has been contained. St. Kitts and Nevis, therefore, announces the opening of their border on October 31st, 2020. The success of this strategy requires effort on everyone's part. People from all walks of life must keep practicing social distancing. Maintain a separation of 6 feet or 2 meters indoors and 3 to 4 feet or 1 meter outdoors. If this isn't possible, masks must be properly worn. Businesses can provide hand sanitizer, conduct temperature checks, record customers' contact information, and manage crowds. Clean and sanitize high-touch areas regularly. Dividers or staggered seating can be used to maintain proper social distance. This protects workers and customers.
is on.
Good afternoon and welcome once again to the National Emergency Operations Center COVID-19 weekly briefing for the 25th of November 2020. I am Les Roy Williams. This is our second briefing in the space of 1 week. So we continue to keep you up to date with what is happening with respect to the management of the COVID-19 pandemic here in St. Kitts and Nevis, and to underscore the important role that you, the public, the general public, play, all citizens and residents, in terms of keeping the Federation of St. Kitts and Nevis safe. Today I would first invite Mr. Kumar Kirpalani, who is the General Manager of Food Center and ODI Brisbane, to make a presentation to the Ministry of Health of 20,000 face masks. I invite Dr. Wilkinson, the Medical Chief of Staff at the Joseph N. France General Hospital, to accept the donation.
Good afternoon. It's an honor to be here today to do a presentation on behalf of ODI Brisbane and Sons. My name is Kumar Kripalani and I am the General Manager of Food Center and ODI Brisbane. I know it's not an easy task that the frontline workers are doing, and we definitely wish them all the best and we have them in our prayers. What we are doing today is we are donating some face masks, and we hope that it will go a long way in the fight against this pandemic. So without any further ado, Dr. Wilkinson, I present the face mask. Thank you.
On behalf of the Ministry of Health, I want to tell the nation how grateful we are for this generous contribution. This is just 50 of the masks, but there are 20,000 others that we have. And we know that the mask is a very important tool in the armamentarium in the fight against COVID-19. And we're happy that you had the frontline workers on your mind. You mentioned that you were praying. There are a lot of people who are praying for us, but we are happy that you went beyond the prayers and that with the all-of-society approach, you decided to make this donation. So we thank you for this, and I'm pretty certain that every healthcare worker who would put this mask on their face, it will not only be protecting them, but we know that it helps to protect the persons who are around us. So you have made a significant contribution in the fight against COVID-19. We thank you very much.
Thank you.
Thank you very much, Kumar, for that donation. I now invite Superintendent Cromwell Henry, Divisional Commander for District A, and a member of the COVID-19 National Task Force, to give us his presentation.
Pleasant good afternoon all, and thank you, Mr. Williams. Now this afternoon I would use my presentation to appeal to sport lovers generally, but the football fans in particular. As we are at the start of the final 6 playoffs, large crowds are anticipated at the stadium to cheer on your favorite teams. We remind you that you are to enjoy these matches in the context of COVID-19. Large crowds are to be avoided. However, if you do attend the matches, then you must adhere to the COVID-19 protocols as stipulated by the Emergency Powers Regulation. Regulation 13 specifies a person may attend a recreational sporting event, and all persons shall adhere to social and physical distancing protocols as far as reasonably practicable. All persons shall wear a face mask covering your nose and mouth, and shall adhere to the hygiene protocols. Now, these are basic protocols that we admonish persons to adhere to generally, but more so in the stadium environment where you are in close contact with other persons. The seating arrangements shall allow for a minimum of 6 feet between persons, and distance markers must indicate where each person may sit. As we continue to prevent the spread of the coronavirus in the Federation, we urge the full cooperation of all persons attending these matches. Police officers and other security personnel will be in attendance to enforce the protocols. We have exercised much restraint to date. It is not our intention to curtail the matches prematurely. However, in the interest of public safety, this option may be exercised. We therefore again urge attendees of the matches to adhere to all the COVID-19 protocols and to give the security personnel on duty your fullest cooperation. Thank you.
Thank you, Superintendent. That was very short. I now invite the Chief Medical Officer, Dr. Hazel Laws, and a member of the COVID-19 National Task Force to give us her presentation. She probably will be shorter.
Good afternoon, everyone. Thank you, Mr. Williams. This afternoon, I will share with you the situation report from the Health Emergency Operating Center. Recently, within the past few days, we would have reported 3 newly diagnosed imported cases of COVID-19, bringing our total to 22. These 3 individuals who have been recently diagnosed with COVID-19, they have been in quarantine since arrival into the Federation. Please note that our protocols are being followed by our frontline workers who would have interacted with these individuals. At present, our public health team is in the process of tracing all the contacts of these 3 cases. So they are being interviewed. Some have been placed in quarantine. They are being tested and monitored. As I said before, at present, the Federation would have reported 22 confirmed cases of COVID-19. At present, our rate of infection per 100,000 stands at 41.34. Globally, based on the World Health Organization's dashboard, the total number of persons confirmed with this dreaded disease between January of this year and present stands at 59,204,902. The death toll globally stands at 1.3 million. What's happening in the United States of America? Well, over 12 million persons have been confirmed with COVID-19 to date. The death toll is almost 260,000. And interestingly, based on CNN, within the last fortnight or 14 days, 2,286,214 persons were diagnosed, and that's just within the last 2-week period. The U.S. has set another record, and this is with regards to the number of children that have been diagnosed with this disease. And so there were 144,000 new cases of COVID-19 reported in children as at the end of last week. What's happening in the Caribbean region? Well, over 282,000 have been confirmed with COVID-19, and the death toll within the Caribbean region is 4,974. In the Caribbean member states, within the last 2-week period, St. Lucia would have reported 84 cases within the last fortnight, Dominica 14, Barbados 17. In St. Kitts and Nevis, we continue to test those who would come into the island from hotspots and any suspected cases. And so between March, April to present, over 3,800 persons have been tested here in the Federation. Majority of these tests were processed by our local private laboratory. At present, we have almost over 206 persons in quarantine, some being quarantined at home under security, and as I would have shared, 19 of our 22 cases have recovered and 3 are in isolation. This highlights the website or the URL where you can find the entry form. Any interested persons planning a trip to St. Kitts and Nevis, here's where you find the entry form, knatravelform.kn. This form must be completed with the relevant information. You also you are asked to complete and provide us with a negative RT-PCR test, and you also have to provide us information regarding your accommodation. All right, so the pre-arrival requirements for all the travelers: you must submit a negative COVID-19 reverse transcriptase polymerase chain reaction test. This test must be done within 3 days of travel at an accredited laboratory. All right, inbound travelers will only be granted permission to enter if you would submit a negative reverse transcription polymerase chain reaction lab test along with the hotel reservation. All right, and so, ladies and gentlemen, we continue accepting nationals who are returning from hotspots, mainly the United States of America, Canada, and some are coming in from the United Kingdom. And once we continue to do so, the risk of reimporting the virus remains extremely high. Okay, so how can you protect yourself from the virus in this regard? We want you to continue wearing your face mask when in public places, maintain hand hygiene, and maintain a 6 feet distance away from others and avoid crowds. All right, so I just wanted to share that there is good news. There is a vaccine on the horizon. Pfizer and BioNTech would have submitted their documents to the FDA for approval, and it's hopeful that by mid-December, frontline health workers and high-risk individuals who are at higher risk, meaning individuals with chronic conditions and those who are older, they may be able to access this vaccine as soon as mid-December. Thank you.
Thank you very much, Dr. Laws. I now invite Mr. Abdia Samuel, the chair of the COVID-19 National Task Force and the National Disaster Coordinator, to give us his presentation.
Thank you, Mr. Williams, and good afternoon to all. Welcome to this another National Emergency Operations Center briefing. This presentation will focus on some of the responsibilities of the inbound traveler. Now, customs charges and transportation. Inbound travelers will be responsible for the payment of any customs fees, charge on goods imported into the Federation. Travelers will be responsible for payment of fees for transportation from the port of entries, whether it be by air or sea, to the place of abode. Persons traveling to Nevis will also bear the responsibility of paying for their transportation via land and also via sea. The reason I am advising on this is because persons do enter the Federation and they come with the expectation that the government or the National COVID-19 Task Force will be paying for these services. Please know that these services is your responsibility. Accommodations, the inbound traveler will be responsible for making their reservation at a COVID-19 certified and approved accommodation. The National COVID-19 Task Force will not be making reservation for anyone. Please note you are responsible for making your own reservations. The traveler will also be responsible for all fees associated with the accommodation for the period of quarantine or vacationing in place. Meals and personal services. Travelers will be responsible for arrangement of meals during the period of quarantine. Travelers are also responsible for any services associated with being in quarantine as it regards to meals and personal services such as laundry and everything else. Testing. Travelers will be responsible for the payments of the RT-PCR COVID-19 tests and any other medical services that you may require. Please note that these are your responsibilities. Custom charges and transportation, accommodations, meals and personal services, and testing. Again, you would have heard Superintendent Henry speak to the sporting community. We continue to appeal to the sporting community to do the necessary to stay safe on and off the field by ensuring that you follow the protocols. That is very critical. And anyone within the sporting community that is desirous of hosting any type of events as it regards to sports, please note that you must seek permission from the Ministry of Sports. Please note that you must seek permission from the Ministry of Sports. This evening at approximately 6:30, there will be a meeting with the homeowners for the Fort Tyson Rise area in Frigate Bay. The venue for this meeting will be at the Royal St. Kitts Hotel Conference Room, and it will begin at 6:30 p.m. The purpose for this meeting is to have a conversation with the engineers who are investigating this incident and for us to map the roadway forward for recovery. The weather outlook as we approach the end of the 2020 Atlantic hurricane season. So far, we have experienced 30 Atlantic storms for the 2020 hurricane season that will end on the 30th of November. This surpasses the record set in 2005, where 28 storms were experienced in 2005. The weather forecast for St. Kitts and Nevis for tonight we have a 20% or slight chance of showers for tonight. So basically we should have a very beautiful night tonight. And the sunset for today will be 5:35 p.m. and sunrise tomorrow is 6:22 a.m. I want to give special commendation to Mr. Ernest Amry and the American Bakery family for their continued contribution to nation building through supporting social programs. On his birthday, he would have given away 5,000 meals, and this act of patriotism and love for country continued to be commended and lauded. I want to appeal to the taxi operators in particular and citizens and residents of this country. We have been experiencing a challenge whereby family members of inbound passengers continue to somewhat stalk the taxi operators when they are taking the inbound passengers from the airport to the place of abode, and they are flagging them down and attempting to stop them to engage with the family. This is a dangerous practice, and we're asking persons to cease and desist from doing so. Our teams are patrolling along with the police, with the security forces, and being in breach of this, you may cause the taxi operator to lose his license to operate, and also you're endangering yourself, your family, and everyone else. We are asking persons to please cease and desist from this such practice. Thank you.
Thank you very much, Mr. Abdias Samuel. That brings us now to our question and answer segment. And the first question, how large a gathering has to be considered a mass gathering? Quite an important question indeed.
Okay, in the context of COVID-19 pandemic, mass gathering is considered the bringing together of people for an event that would have the potential to put a strain on the planning and the health response to that event. And so there is no single cap on that. It all depends on where the place is and the duration of the place. So the things that are considered when you're looking at a mass gathering in the context of COVID-19 are the number of persons, the duration, and where the place is. For example, you can have a tent where you can have 200 persons attending a funeral for 1 hour, a funeral service for 1 hour, that you can give permission to. But under that same tent, if you had 50 persons who are having a party that's going to go from 12 midnight until morning, you might not get permission for that. And so there are different things that go into consideration when we are considering mass gathering. And that's why sometimes persons may complain, oh, how come this person was given permission for X amount and I had a half X, but my thing was turned down. And so there are different things that we have to take into consideration. We also consider whether or not there will be alcohol, music, etc., that would impair social distancing at the event. Thank you.
Okay, the next question has to do with the guards that stay at the, where do the overnight guard at home quarantine facilities stay? Do you have to have a hut outside to accommodate such? Superintendent.
One of the conditions for approval for home quarantine is that there must be some facility for the guard. So if you have a garage where the guard can occupy and have a good view of the access to the home, then the garage would be used as his shelter. If not, then there must be some temporary tent or similar structure that must be provided so that it could provide shelter for the security guard.
Someone is asking about what is the ruling for a Christmas concert? I think, and will they be allowed with mask and social distancing? And are churches supposed to use their AC now? Dr. Wilkinson.
What we're asking at this time is for people to use sound judgment. We cannot police every single activity. And so from the presentations and the advice that you have heard us made here, we're asking persons to avoid mass gatherings, which will include gathering in enclosed spaces. I've said before that my advice is to try and postpone things like parties, fetes, concerts, etc. We are encouraging people to do as many things as virtual as possible. And so I think that instead of having the big Christmas concerts that some of the organizations were accustomed to have, they can have it virtually. As a matter of fact, a lot of these virtual events are having more people looking at them than when they were in person. And so maybe this year I might enjoy my Anglican Christmas concert from the confines of my home instead of having to go into the church and sit down. And in terms of air condition, we're not saying that you should not use air condition, but it's better for you to be outdoors than indoors. It's better for you to have open air than an enclosed space. And so one has to use judgment, and this is where personal responsibility comes in. And so for the organizers and planners, if you're planning a concert, you need to know that we have to have proper social distancing. And when we speak about 3 to 6 feet, we're not just talking about laterally, but in front, behind, etc. And so it will be almost impossible for you to get the same financial rewards in terms of packing a studio or church or building if you have to do that amount of social distancing, but you might get more response from having it virtually. So my advice is to see how much we can do these things virtually. And don't forget, I said, we have gotten this far. We are rounding the curve, that's what Trump used to say. Okay, but there's a vaccine on the horizon, and let's see what happens in January. We can hold off most of these things in December and wait and see what happens in January. Thank you.
Thank you, Dr. Wilkins. So this next question, shouldn't the task force give guidelines for the Christmas shopping like they did when we had 2 shopping days, line up outside the supermarket and so on? Obvious.
Thank you for that question, Mr. Williams. And yes, we have been engaging with a number of business places. Just last week, we would have had a major engagement with TDC and other group of companies in terms of how should the VAT day in particular shopping spree should be conducted. And yes, we will be providing some guidelines for persons. However, we encourage business places to develop some proposals and guidelines as to how they think according to the size, the capacity of the business, and the load of business that they get into their companies during these days, to send us a proposal so that we can vet it and have a discussion with them. But again, if you apply the protocols that are there already, that should be able to guide the process. However, we want to encourage persons to use the virtual platforms to do a number of the shopping activities that you need to do, or you can actually start shopping now.
Thank you, Abdias. This next question relates to the latest 2 confirmed cases. Why were the latest 2 cases retested? They were supposed to have presented negative test results within 72 hours of arrival. At what point and why were they retested? Dr. Laws.
Very good question, Mr. Williams. Our protocols continue to guide our operations, and our protocols dictate that if an individual upon arrival is experiencing COVID-like symptoms, that individual should be tested upon arrival. Our protocols also state if upon arrival there is any question regarding the authenticity of the pre-arrival PCR test or any query there may be with regards to the pre-arrival COVID test, such an individual is tested upon arrival. And so our latest 2 cases, they were tested upon arrival and found to be positive. Thank you.
Thank you, Dr. Laws. These last questions are from Von Radio in Nevis. With regards to a notice issued to the staff of the Park Hyatt Hotel, alerting them of the 2 positive cases of COVID-19 prior to yesterday's emergency briefing, assuming that this means that the 2 positive cases came from Park Hyatt, are staff members of the hotel expected to undergo any contact tracing and possible quarantine? Dr. Laws.
Mr. Williams, I cannot speak to the communication that would have been disseminated by the manager of Park Hyatt, but what I can say is I can speak about the 2 confirmed cases, and I want to assure the general public that the public health team has been in touch with and has been interviewing all the contacts of the confirmed cases. These are frontline workers who would have interacted with these individuals along the corridor of containment between their landing in the Federation last Saturday and arriving into their rooms on the hotel property. And that's been done. And a number of them have been tested, results have been received, negative so far. And so I want to assure the public that the entire process of contact tracing is robust, and the public health team continues its work in this regard. Thank you.
And the last question is related to mass gatherings, and it comes from Von Radio as well. What about funerals and weddings at this time? Superintendent, I think this is one of those questions that go around like that, but.
Well, funeral and weddings, while there are some restrictions, they are not prohibited. A person could keep a funeral, you can get married, you just have to observe the protocols. Wear your mask, observe physical distancing, and hand sanitize. Just as any other gathering, you must follow the protocols at these events. But funerals and weddings, they are permitted. There is one restriction on them though, they cannot go on for more than 1 hour.
Okay, thank you to all of you who posed your questions. I hope that they were answered in a satisfactory manner. If not, you can always ask a follow-up question. But that brings us to the end of our NEOC COVID-19 weekly briefing for today. I want to thank the very hard-working people, Superintendent Cromwell Henry, Chief Medical Officer Dr. Hazel Laws, Mr. Abdius Samuel, Dr. Cameron Wilkinson, the hard-working staff of ZIZ. I see AJ is the lone person here today. We thank him, and we thank all the media for continuing to work with us. We thank Ms. Vesta Southwell, and we thank Mrs. Christmas Jacobs for her sign language support here. And this I must thank myself. So I thank myself. Thanks to all of you for tuning in today for today's NEOC COVID-19 weekly briefing. We will see you back next week, Wednesday, at 5 p.m. and not before.
Is on.